Imagine losing your sight very slowly, without any pain, without any symptoms, until it gets to the later stage. This is exactly how glaucoma steals vision from people. And this is the reason why it is called the silent thief of sight. My name is Dr. Onochie. I am from Eagle Eye Foundation. So today we will briefly look at glaucoma and what it entails. What is glaucoma? So glaucoma is a group of eye diseases that affect the optic nerve head. I would liken this optic nerve head to electrical wiring. These wires take signals from what we see to the brain for interpretation. Any damage to the optic nerve head is often permanent. Hence, glaucoma is an important topic of discussion. Who is at risk of this glaucoma? First of all, age is number one. If you are up to 40 years and above, regular eye checkup is for you so that we can dictate when this disease is coming. The second risk factor is persons that have diabetes and hypertension, prolonged diabetes and hypertension, especially when it is not properly managed. This can lead to damage of the optic nerve head. Then the next one is family history. This is where it is very important. You talk about some families have history of blindness and they don't really know what really caused that blindness. It's a call for check of your eye to see if you have glaucoma. Then the next on the risk factor is increase in IOP. IOP means intraocular pressure. Within our eyes constantly secrete fluid called the aqueous humor, and it has to be balanced between production and removal of such fluid. Any factor that disturbs the rate at which it is removed and favors the rate of production, this will lead to increase in IOP. And what does this cause? It damages the optic nerve head, and that is glaucoma. Now, what are the symptoms? This is where it becomes very scary. At the early stage, there is no visible symptom, there is no visible signs from the patient. You will not even know that you are losing your vision because the damage from glaucoma starts from the peripheral vision, then gets more centrally with time. And that is when patients rush to the clinics or hospitals. By that time, there is no remedy, there is no cure at that point. Now, we'll look at how do doctors diagnose glaucoma. It starts from one simple step, and that is routine eye checkup. How often do you visit your hospital? How often do you visit your ophthalmologist? How often do you visit your optometrist? That is the first point of action. Then when you arrive at the hospital, the doctor checks your eye pressure. When the doctor checks your eye pressure, whatever he finds out, that will give him a clue of what is going on. Then he goes on to check the inside of the eye. There are landmarks. There are things that are being looked at before we can say someone has glaucoma. When this test, some of the tests will include, we want to test how you are seeing your peripheral vision. How do you appreciate things that are not central? That is one of the tests we normally carry out. Then we go on to check the thickness of your black eye called the cornea. That will also help us to adjust any issues regarding the intraocular pressure we've taken earlier. These are just the basic tests that needs to be carried out before glaucoma can actually be diagnosed. Then we talk about the management now. Often, glaucoma is a management disease. It's not something that can be treated of, then you go. No. The first line of treatment is use of eye drops to bring down the intraocular pressure, because that is the only modifiable factor when it comes to glaucoma. We want to bring down this intraocular pressure. Then with time, if this pressure is not responding to topical medications, you might be booked for surgery. Surgery is not to treat it per se, but to open up holes in the eye where this fluid that is being created, that is being produced by the eye, should be taken out from. Glaucoma doesn't announce itself when it wants to come. It quietly steals your vision. Don't wait for symptoms before you visit an eye clinic. Regular eye examination can actually save your vision. Protect your vision today, because once it is gone, it cannot be reversed. I'll see you on the next series when we discuss other eye conditions. Thank you.
Eagle eye, we rise with